I welcome you back to another episode of Dr. Hair Loss's podcast video series where I dissect different topics around hair loss. Today's topic is quite dear to me and has been suggested by a few of my colleagues and friends who wanted me to talk about use of anabolic steroids, performance enhancing drugs, and its impact on hair loss. In this video, we'll talk about the mechanistic effects, management strategies, and why people using performance enhancing drugs and anabolic steroids lose their hair. We'll talk a bit about science, try and keep it as simple as possible. And then by delineating and dissecting that science, we'll talk about what treatment strategies can be applied to reduce, reverse, and get your hair back. So let's delve into it. So performance enhancing drugs and anabolic steroids have been there for decades. We know that people use it to increase muscle mass, strength, endurance, having a cutting edge from their competitors. And most commonly, the sport that it is associated with is your bodybuilding sport. Apart from Hadi Chopin, Jay Cutler, maybe a few more, I can't really recall a professional bodybuilder competing in Arnold Classic or Mr. Olympia having hair on the head. And this is mostly due to an excessive amount of testosterone that is being used exogenously to increase their muscle mass. This is no secret, and everyone knows that. So why does this happen? What does steroids, whether it's endogenous, which means inside the body, your own production of steroids, or exogenous, which is the external steroid that is being injected, do to hair? And how is it connected? If you remember the old heroes in the 70s and 80s, especially if you watched Bollywood movies, you would realize that a true man or a sign of masculinity was body hair, a lot of body hair. But often you'd find their temples receding. And yes, that holds true in the scientific sense. When you have excessive amount of testosterone, this excessive testosterone leads to hair fall on your head, but then excessive hair is seen in other unwanted parts of your body. Your back, buttocks, chest, facial hair. And there is science behind that, and we'll talk about that. So, what actually happens, and what does testosterone does to your hair follicles? Well, testosterone in itself, as we know, is a male hormone. We all have it. It's in excess and a higher level when you're in your 20s and 30s, and it slowly falls down as you grow older and older. And by the age of 70, 80, it is at a very low stage. Now, this is not only associated with masculinity, it is the true male hormone that can affect a lot of different functions. And we'll delve into that in a different video. So, testosterone is converted into dihydrotestosterone, which is a more potent, very strong androgen steroid. This is done by an enzyme called 5-alpha reductase. DHT binds to some receptors in your hair follicle. So that's how it's connected. Now, when it binds to your hair follicles and it's in excess, it causes miniaturization or thinning of your hair and eventually leading to hair fall. Similar thing happens when you're using exogenous or external testosterone. When you use exogenous testosterone, we find that the testosterone levels rise in the body, again leads to excessive DHT in the scalp, leading to a hair fall in the scalp and vertex region. This is very much akin to male pattern baldness, and there is scientific evidence that it does that. It can also impact and disrupt the balance between testosterone and estrogen in your body. And as we know, estrogen has a protective effect on the hair, leading to increased anagen phase, which is your growth phase. But unfortunately, due to this disbalance, the estrogen can fall and again can result in hair loss. Finally, the androgens stimulate sebaceous glands in the scalp, leading to an increased sebum production. Now, these excessive sebum can result in causing your scalp to have conditions like seborrheic dermatitis, fungal infections, etc. Hence, an oily scalp can result in hair loss. So this brings me on to the management strategies. If you look at the management strategies uh, for this kind of hair loss, again, the answer is quite simple. If you're using exogenous testosterone, you need to stop using it. The most effective way, or the only treatment that would work in this case, is to reduce or discontinue. And after discontinuing steroids, post-cycle therapy is normally recommended with a selective estrogen receptor modulator, beta-HCG, to help restore your natural testosterone production. Often this shuts down completely in people who've used steroids for a very long period of time, and their own testosterone production just does not come back. Secondly, I think very obvious is the inhibition of 5-alpha reductase. We spoke about DHT being formed from testosterone by 5-alpha reductase, and inhibiting that enzyme will stop the production of DHT. And what does that? You may have heard about finasteride. Finasteride is a 5-alpha reductase inhibitor and is used in other conditions such as prostate conditions. It comes with the name Propecia and has been FDA approved for quite some time and is probably the oldest player in the market of hair loss. It is scientifically proven and has evidence that it stops hair loss. In fact, it is one of the most powerful drugs that are out there. A lot of my patients do not like taking finasteride, and the reason for that is that there is a side effect of impotence, difficulty having erections, and sexual dysfunction. And again, this puts a lot of people away from finasteride. The incidence of this side effect is very low. It's 4 out of 100. But again, you could be one of those people who can have these side effects. To counteract this, there is a topical formulation of finasteride, which means the same tablet is in a topical form. You can spray it on your scalp, and this is relatively new. Again, the evidence behind this is lacking, but biologically, I think there is plausibility that this should work because you're spraying the finasteride topically on your scalp. There should be some absorption in your scalp and hopefully prevent systemic absorption. So you're not taking a tablet, you're not affecting anything else, you're just spraying it. Other side effects that I've seen, and I myself have suffered from, is gynecomastia, which is painful breast, and it happens very quickly. So puts a lot of people away from finasteride. In fact, younger people always ask me about the side effects and end up not taking it. Other treatments that are beneficial are minoxidil, the obvious one. Again, very popular. It's a topical vasodilator, increases the blood flow to your scalp, and can be used in conjunction with finasteride. Now, my personal favorite medication in this case is dutasteride, which is again 5-alpha reductase inhibitor, much stronger than finasteride, and has little side effects with regards to sexual dysfunction. At Dr. Hair Loss, we are formulating a combined minoxidil and dutasteride spray for you, which would not only eliminate the side effects from finasteride, it would also be more potent and be used alongside minoxidil, covering all bases. This will be out very soon, and I'd advise you to continue seeing my videos to see when we're releasing this. In addition, I think very important for people who've used exogenous steroids for a very long period of time, there are lots of side effects, and we certainly do not promote or endorse steroid use. And I'd say diet and nutrition is key. We have to make sure that we have antioxidants in our diet, including copper, selenium, zinc intake. We find that ferritin deficiency or iron deficiency in men and women can result in hair loss. It's important to get your blood test checked. And finally, I think stress is really important to be managed because it can really lead to quite rapid hair loss, which is known as telogen effluvium. We at Dr. Hair Loss are also vested in finding the underlying cause of your hair loss, and we end up doing a full hormone profile alongside thyroid test, trace elements, blood counts, liver tests, renal tests. We'll give you a full checkup with regards to any potential cause that may be causing your hair loss apart from any medications that you're using. So, in conclusion, performance enhancing drugs, anabolic steroids, have a lot of different side effects. One of them is hair loss. It's caused by excessive testosterone, causing miniaturization of your hair scalp. This can be reversed or stopped alongside using these medications by using things like finasteride, dutasteride, and complementing that with minoxidil, a good diet, stopping smoking and alcohol, and managing stress. Well, I hope that you found this video helpful. I will be back with other topics. If you want me to discuss anything else with regards to hair loss, please put your comments in the comment section below. And as always, you're not alone in your hair loss journey. Thank you.